Kevin Courtney from the General Secretary of the National Education Union, who's made the headlines today after telling teachers not to engage with planning a June 1st return, but to wait for further union advice. Good morning and thank you for joining us today. So this advice that they would be waiting for, what would that advice be?
Well, we've asked the government to engage with us. None of the unions knew that the Prime Minister was going to say 3-year groups starting back on Sunday. None of us knew that he would then add nursery schools into it when there was a paper on Monday. We've been asking for evidence of a number of things that would inform planning. We've been asking for evidence about how much the virus transmits between children, how much it transmits from children to adults, which adults might therefore be vulnerable. You know, what happens if a child is living with a vulnerable grandparent? Should they be in school or not? I'm afraid that so far the government's guidance doesn't touch on any of those matters. There is no reference in the government guidance to transmission between children, no reference to vulnerable adults. We think we need much more scientific evidence before we can sensibly and safely plan for a return to schools.
So there are a lot of parents now, obviously listened to that advice, which years were going to go back, and the date, the fact that it was going to be June the 1st, and thinking about, all right, well, are we going to do it? A little bit worried about it. So what are you saying now on behalf of your union? Are you saying, don't even worry about it, parents, because we're not going anyway?
Well, I think it's important to say that even the government doesn't say it's June the 1st. June the 1st is a target date for them if the rest of the science is in the right place, they say. But we're not clear what they mean by that. We're not sure what test they're applying to this matter. But we do think there are lots of things that haven't been sorted through. So, for example, if you're in an infant school, so not a JMI, not a junior mixed and infant, but just the infant part of the school, then you have only nursery, reception, year 1 and year 2, and 3 of those year groups are supposed to come back. And then you're supposed to split the kids from 30 into 2 groups of 15. There just aren't enough rooms in the school. So there is huge amounts of detail that the government has not helped with yet. We want to engage with government. We want to engage on whether it's safe to go back or not, because they haven't given us any public science on these matters. And we keep hearing experts in virology telling us that children do transmit it. And then we hear, we think these are small numbers of cases, but there are 100 children in hospital in New York City with this new Kawasaki syndrome, which people think is linked to COVID-19. Now, if that's the case, then we will need to be more careful about social distancing between children. It depends how much virus is circulating in our society, obviously, when we open the schools, how much of a worry these are. But we're not clear from the government how much virus they will allow to have.
So if we get to the point where the government, in one of the briefings that we watch each afternoon, say, right, OK, well, we're beginning to meet the criteria for that opening on June the 1st. I've got to ask you again, if the government decide the criteria have been met and you haven't been given any clearer information, will you say to your members, don't go back?
If we're not convinced that it's safe, then we'll say to members, we're not convinced that it's safe. And if we say that, then there are provisions that people can use. People cannot be compelled to work in unsafe environments. We don't want to be in that position. We want to work with the government on when it would be safe and how you could then safely open schools. But we're not there yet. And if we think it's going to be unsafe, we really aren't just thinking about our members in this. Our members are teachers, teaching assistants, and their first concern is the safety of the children
If we look at other countries and how they're dealing with it and how they're keeping their teaching staff safe, countries such as China and Lebanon are reportedly spraying children down with disinfectant before they enter. These are incredible, shocking scenes, actually, to watch as a parent. I couldn't think of anything worse. We did put this to Matt Hancock yesterday, who said that this wouldn't happen here.
You've actually got it here.
Well, let's just take a look at what he said. At that age, can they socially distance? Will they be kept safe? Is Chester going to have to go to school in a mask? Is his teacher going to have to wear a mask? Is he going to have to be spray disinfected as he's walking through the door? We're all sort of filling in the blanks a little bit.
Yeah, look, firstly, he's not going to be having to be sprayed with disinfectant. I did see that from one proposal from a union. That is absolutely not going to happen.
So he says that's absolutely not going to happen. You've said before that this is a possibility.
Well, we think that there's something like that. It's not that we should look at. I mean, the fact that China, South Korea are doing that sort of thing and do have the death rate much lower than ours means there may be something to look at in there.
You can't imagine, sorry to interrupt, you can't imagine that in this country we would spray children like that with absolutely no idea of the health consequences down the line. I mean, this is like, it's like the old days of DDT, no clue of what's going to happen to their health in the future.
No, absolutely. We wouldn't support that. But the government says in the guidance that they have brought out, it says that in schools you have to remove soft furnishings, you have to remove soft toys, you have to remove toys that you can't clean easily, and that's because of the risk of virus being on those things. So you could imagine children, as they come in, washing their hands, and then you could imagine possibly disinfecting their belongings, the bag they've brought with them, not spraying them like in those shots, but you could imagine disinfecting their belongings. We'd like the scientists to tell us what sort of contribution that would make to keeping their schools safe.
Which makes sense. Thank you, Kevin.